Good morning, everyone, and welcome to this CQC webinar on our local authority assessment work. It was a very crowded lobby this morning, so it's taken a while to get everyone in, but you're all very welcome, and I hope you will find the time well spent. I'm Mary Cridge, I'm the Director of Adult Social Care here at CQC, and it's my team who've been working with colleagues across our organisation to develop, pilot and now get underway with this work. So I'll introduce you to our webinar team, or at least a list of their names. They will introduce themselves as they come on and speak, but Amanda and Lella will be sharing the presenting role with me and will be part of our panel when we get to our Q&A session at the end. And I know it's hard to hold the questions in your head as we go through this sort of thing. So do please post your questions in the Q&A side of the chat when they occur to you. And other colleagues with us today will not moderate those, they will collect those up for us at the end. We'll do our best to stick to time. We hope everything runs smoothly, but we're using technology, so if we do encounter any heffalump traps, we'll obviously deal with those as they arise. We'll only be answering questions relating to the topic of the day, but if there's anything else that you want to throw in there, don't worry, it'll all be picked up. This is being recorded and a copy will go on our YouTube channel later, and we'll send you the slides after the event. Okay, so let's just have a look at what we'll be covering today then. So we got our new role in April, and we spent the summer running our pilots. So we'll touch briefly on the role itself. We'll talk to you about the assessment process and how we gather evidence, and also cover how we report our findings. But we've got almost half an hour for the question and answer session, because that's a really important part of today. We want to answer what you want to know. So without further ado, then let's have a look at our role in assessing local authorities. So at CQC, we've developed a new single assessment framework that is has been built in co-production, principally with Think Local, Act Personal, and we're using the I and the we statements because we believe that gets to the heart of what people expect from their care. And through the pilot, we've established that the 9 quality statements we've selected enable us to assess whether and how well a local authority is meeting its responsibilities under the Care Act Part 1. And within the framework, the evidence comes in 4 themes, which builds up to the overall picture. So looking at working with people, how support is provided, ensuring safety and leadership. So all of those elements were tested in the pilot, and the final way we're doing things has been informed by that. So it all builds up, and when you look at it in the whole, as you can, in our guidance, we found that it provides the right framework for us to undertake our inquiries and reach an assessment from the evidence that so helpfully has been provided. Okay, so welcome to all those who are joining us as we go. So if we move on. So I've mentioned the pilots, and let me say again, thank you to these 5 local authorities for putting themselves forward for this. It really helped us to explore how this is going to work and refine it as we go. And we had a formal evaluation of the pilot, so we got the lessons and the learning, and it's been given us a really firm basis on how to proceed. And as it says there on the slide, it was all it enabled us to test all elements of our process and to iterate and develop as we went along. So what we were doing by the time we got to Suffolk in pilot 5 was quite different from the first, particularly in the area of getting people's voices. We learnt a lot, and provider voices. We learnt a lot about the best way to go about that. So that has been built in, and it also was great to start building relationships with both the local authorities themselves and other organisations that play in those areas. And of course, our colleagues looking at the integrated care system work went on to look at Birmingham and Solihull as part of their work. So it's really useful that we've been to Birmingham as one of our pilots. So we got some themes from the pilots, which is our next slide, I believe. So yeah, here's the headlines from those pilots, and it was great to see these themes emerge. Not to the same extent everywhere, but these were the heart of the matter as we went through. Of course, we were piloting a time when winter officially hadn't started. So we were looking at what was being done, what had been done, and it was quite striking how those local authorities who had been given their rightful place in the system and views taken account of and working with and alongside acute and community health provision had really had an impact on the flow of people in and out. And so that we saw that work was ongoing and informing what was being done for winter. I don't suppose it will be a surprise to many of you on this call that the key component of waiting lists really was lack of capacity. So matching capacity to demand is a perennial challenge, isn't it, for those of us delivering a service. But we saw that local authorities were actively managing this, regular risk assessments and so on. You know, that was one of the ways we saw. But in these times where waiting lists occur and emerge, the active management of waiting lists was really making a difference. So there's stuff to learn from that. Partnership working was a theme for us and indeed for our colleagues in the integrated care system work. As well as us learning about how to reach and really hear people's voices, this was a theme as well. And some voices are easier to hear than others, aren't they? So the best way to do this, that was another, everyone has work to do in learning the best way. And capacity issues, again, with the social work workforce was another theme. And we heard about the efforts being around recruitment and retention, and indeed some really inspiring stuff about growing your own and people taking up apprenticeships and other pathways into the social work profession, which was great to see. And we had some real enthusiasm and appreciation from people working in the local authorities where that was the case. And we found that there was a great learning culture. So the idea of what can we learn, how do we identify when things go wrong, what can we learn and how can we improve? There was a real dedication to that was another theme. So that was heartening, heartening for the team, and pleased to report that as the themes. Right, you're going to get a rest from me now. I'm going to hand over to Amanda, who's going to talk to us about the assessment process. Amanda.
Thank you, Mary. So I'm Amanda Stride. I'm Deputy Director for Local Authority Assessments, and I've been working with the team on developing the approach and delivering on the pilots, and now we've moved into our formal rollout stage. So I'm going to take you through the process that we are following before handing over to my colleague Bella for some more detail. So first of all, what you can expect from us. Our assessments are made up of a number of different elements. So while there's a lot of focus on site visit part, there's an awful lot of work and activity that goes on before we get to that bit. But we start with our information return. So we write to local authorities when we are in batches, and we inform them that we would like them to complete their information return and ask for some other information as well. And we give local authorities all the same amount of time to complete that, which is currently 3 weeks, and so they return the information in that time set. And we use that information to help us plan and conduct our other activity. And I'll talk a little bit more about the information return on the next slide. But what we also do is we ask for information about voluntary and community groups, as well as about staff groups within the local authority and partners. And from the pilots, we know that talking to voluntary and community and advocacy groups is vital. And what we've learned is that doing that up front before we get on site is a really useful activity for us. So we will engage with these groups using information that's been provided to us. And we also send out a provider survey to all registered providers in that area. So we gather in lots of information that we use for leading up to a site visit. We say that you only need to provide us with the information we've asked for when we've asked for it. So if you haven't asked for it, don't worry about sending it to us. And we are updating our website to make sure we publish as much information that's useful as possible, and our information return is currently on there. And while we will be carrying out some of our voluntary community work engagement, and while we're looking at the information return, we won't need to be in contact with the local authority level to do that. So what we will then do is give you a separate notification of when we're ready to do the site visit, part of the assessment. And we will give at least 6 to 8 weeks notice for this. And at that point, we will ask for more information around case tracking and sort out various dates with you and have more contact in that time leading up to the site visit. It may be up to 6 months between the information return and when you have a site visit. So we won't be in contact with you until we actually let you know about that site visit. So in terms of the information return, which is the next slide, this is, as I've said, the first step in gathering evidence, and the information provided with us is key to help us do that. And we've worked with ADAS and the Local Government Association and our pilot and local authorities to implement the learning from when we used it in the pilots, and we've streamlined and clarified the document to make it much simpler to use and much clearer on what we're asking for. So as I've said, you only need to send in the documents we've requested. You don't need to create any new information for us. And we will use this as evidence around how a local authority is delivering its adult social care functions, and understand areas that we might want to explore further or collect additional evidence about. And that might be because we've identified a gap that we need to close. We might have identified areas of particular good practice or innovation we want to understand more about. And we use this information to target our voluntary community engagement and our on-site activity. So we don't want to be increasing burdens of repeating the activity that we don't need to do. And then the self-assessment on the next slide, please, is we ask for this as part of the information return, and we invite you to send your self-assessment. Local Government Association and ADAS have supplied guidance for self-assessment, and we're currently working with them to share our findings from the pilot around what went well, and so they can update their guidance. We recognise that self-assessment is something that local authorities will use to understand their own performance, and it might be larger and go wider than what we need for our actual assessments. So we only ask for you to send in what we need for our assessments. And what we would like is a summary showing key successes, the risks, the challenges, and really importantly, we want to understand the actions that we are taking to address the most pressing risks. And we will reflect actions we'll take for the financial impact. And then the next slide is on site visit. So we do an on-site visit as part of our assessments. And as I've said, we will give 6 to 8 weeks notice of this. We will give an allocated week but we will be on site for approximately 2 to 3 days, depending on what we need to do, the size, complexity of the local authority, size of the team that we're building, and those kind of activities. And what we want to do on site is talk to the frontline staff, to executive leaders, portfolio holders, partners. And we'll also talk to people who are drawing on care and support services, or people who don't want to engage with us virtually. So, say a voluntary association may not want to talk to us virtually. We might meet them when we actually go on site. We will, while we stay on site, we will do some of that contact virtually where it's appropriate to do so. And we will interview people either individually or in small groups. We also, and Glenn will come on and talk a little bit more about some of that. That looks like actually inside. And our team on site is led by an assessment manager. They're supported by inspectors. And we will also try to use specialist advisors who are currently managers or leaders who are working for local authorities or similar organisation. And they support with their current expertise on the Care Act. And we may also use executive reviewers who are assistant directors, directors and chief executives from local authorities or similar organisations. And they support us in our focus on leadership and governance within the assessment. And we might involve them in other parts of the process as well. That's working outside. So that's how our process works and how our different activities will come together. I think I'm moving on to another now for the next.
Thanks, Amanda. Hi, everyone. I'm Lella Andrews. I'm one of the assessment managers in the team, and I've been working within the team since we did the test and learn in 2022. So I'm just going to talk to you a bit about how we gather evidence. So next slide, please. Okay, so Amanda's talked about when we'll request evidence and when we're going to do things, but this is about the different ways that we gather evidence. So for every local authority, we'll look at what we already have. So we'll look at our data and insight team to provide us with information from national data collections. And we also, within the organisation, have information about from our regulation of registered adult social care providers and hospitals. So we will look at what we may need to request. There may be something that comes up specifically that we may need to request additional information about, but we're hoping that the work we've done from the pilots in terms of the information return, that those requests will cover everything that we need. So and that within that we look at policies, strategies, some of the internal and external survey results that you may have carried out yourselves, the feedback from staff that you've gathered yourself, and also your self-assessment of performance, as Amanda said. So then we look at what we need to actively collect. So we use case tracking, so that's where we will ask the local authority for information about giving us details for a number of people that we would like to speak to individually, or we would ask that you request that they're happy for us to speak to them individually. We would usually do that via telephone or via Teams, but as Amanda referred to, if there's someone who prefers us to speak to them face to face, then we can do that during our site visit week, or maybe the week before. We hold drop-in sessions for staff, and this is one of the things, as Mary referred to earlier, that we developed through the pilots, and we are likely to do one at the beginning of our site visit and activity, and one at the end, and if appropriate, then we can hold them at different venues, at 2 different venues, so that we can enable staff who may be in a large geographic area to reduce their travel. And we leave those as a very informal session, so we don't need people to book into those. We'll ask the local authority to let all the staff know when and what time it is and where, and then we welcome discussions with anyone who wants to come and talk to us. And that's separate from the interviews that we've set up as part of the site visits with staff groups and leaders. And when we're on the site visits, we will only actively collect the information that we can't get through other means. So we're very conscious of the time that it takes for you all to enable this site visit to happen, and so when we won't just randomly speak to everybody that might want to talk to us, which is and it's great when people do want to talk with us, but we really need to be focused and look at talking to who we need to speak to provide the evidence that we need. Next slide, please. So within the quality statements, we look at 4 of the evidence categories. So within our single assessment framework, all of this information is available on our website. We have 6 possible evidence categories to look at within each quality statement. And for the local authority work, we're only looking at 4. So we're looking at people's experience. So when we gather evidence, it will sit in one of these 4 evidence categories. So either people's experience, feedback from staff and leaders, feedback from partners, and processes. And in terms of processes, we're looking at kind of strategies and more the kind of the written processes. People's experience covers what the local authority tells us within the information return that you know about people who live in your area and what their experiences are of the service provided, and what the services are that are needing to be provided. Feedback from staff and people's experience obviously includes our own conversations with people, and also information that we've been provided from talking to about people's experiences that might be from our discussions with Healthwatch or voluntary and community groups. Feedback from staff and leaders again covers information within the information return, and also from our direct contact with staff and leaders during the site visit. Feedback from partners during the site visit week, it's likely that we will talk to a range of partners. So they may be the local trusts, the hospital trust, so acute mental health, learning disability, community trust. They may be talking to people within the ICS, so place leaders, safeguarding adult board chairs, so a range of people, but again it would be specific to each local authority in terms of who we need to speak to. So the quality statements that we have identified, the 9 quality statements and the 4 evidence categories within those, won't change, but the specific evidence sources that we look at need to be specific to your local authority, and also may change in line with the most up-to-date best practice standards, guidance and information. Next slide, please. So I've pretty much gone through this slide already, so this is just this will be more clear for you about where we're getting information from people using services. One of the ways that we get information from people using services is about arranging to speak with carers. So as well as our case tracking, where we would identify 6 people who are using services to speak to, we also ask the local authorities to provide us with the details of the organisations who support carers locally, and we would contact them prior to coming on site and speak with them about whether they would be happy to talk to some carers about whether they'd be happy to speak with us. And we have a team of experts by experience who are involved with this work. They're part of the assessment team, and they will arrange to speak directly individually with carers and provide the feedback from them as part of our evidence. The conversations we have with the community groups and the voluntary groups is done prior to us coming on site, and we ask you for the contact details from the main voluntary organisations groups that you work with, and we will contact them directly and ask them to provide us with details of smaller groups. And we found this is, as Mary said, it's one of the things we developed during the pilot in order to hear from a wider range of people. I've talked about feedback from staff and leaders, and in terms of feedback from partners, we gather views from care providers as well. We send out a survey to all the registered providers in your local authority area prior to the site visit, and during the site visit we're likely to arrange an interview with the care provider forum chair, and probably 3 or 4 of the local care providers. Next slide, please. So when we're looking at scoring and ratings, we review the evidence within the evidence category. So each of those 4 evidence categories within each of the quality statements is given a score. And it's a score from 1 to 4, 1 being the lowest and 4 the highest. We apply a score to each of those evidence categories. Those evidence category scores are combined to give a score for the quality statements, and then the quality statement scores, the 9 quality statement scores, are combined to give an overall score and a rating for the local authority. Next slide, please. And I think I'm handing back to Mary at this point. Yes, thank you, Mary.
Thank you, Lella. So we get to the next stage of having done all this activity. We are reporting our findings, and some of you may well have had a look at the reports that were produced as a result of the pilots. Those are iterating further, so develop as we go. So when we've got enough evidence, then we start to draft the assessment report, scoring as we go in the way that Lella has described. Local authorities, of course, get an opportunity to check the factual accuracy of the report. So we want to make sure that principally you recognise your organisation and that we've got our facts right. At the moment, we're running calibration panels, if I could say the word, as an additional step in our process. This is where, because we're working in batches, we will look at a group of reports together and just do those checks that make sure that we are being consistent in how we are scoring and rating and validating. And we'll continue to do that until we feel we don't need to do it any longer. And we have some independent members on that, which is very helpful. Our communications team will liaise with the local authority team before publication, and we'll publish our final reports on our website, and the plan is to publish those in batches, and we won't be publishing any reports during any pre-election periods. And we'll also be pulling together themes and issues that we find across the assessments and including those in our annual State of Care report. So if we move on to the next slide on our reporting, the department, the DHSE has asked us to include, on behalf of DLUC, has asked us to include some financial information in the assessment reports. And as it says here, we don't make any assessment of this. We literally get the latest publicly available information and include it as part of the report, really as part of the context. And there's detail in the guidance as to what's included, but basically it's an estimate of what was the budget that year and what was spent. What do we think was spent on was intended to be spent on adult social care, and what was actually spent, and just the information as to whether or not the local authority had raised the full adult social care precept for the year, and to also include a figure for approximately how many people accessing long-term support and those accessing shorter-term support. So this will be information from local authority and published sources that we will add as we have been asked to do. The next point to note is that we have a duty to inform the Secretary of State if we find a local authority failing to perform its functions under the Care Act. And the level for this, as it says there, is any quality statement receiving a score of 1 that applies to everything except the leadership theme and that's because the leadership element is not part of the Care Act. So this all relates to Care Act duties, and the department will provide guidance and coordinate improvement or any intervention in these cases. So just to be clear, we're not referring for intervention, we're referring on the outcome, our findings of the assessment, and then it will be the Secretary of State to decide next steps. If I could have the next slide. We are on to questions. So I think we've just about raced in with 2 minutes to spare. So there are questions to be had in the chat, and I think somebody is going to. Right.
Yes,
Okay.
Mary.
So I've got Mary Ellen, are you going to come forward with the questions?
Yes, so we have got quite a few questions about asking for a bit more information about the information return, so it might be good to go to those first. I'll try and break them up, but there's questions about whether or not there's a template for the information return that that can be accessed in advance, and then a question around the platform that will be used to upload the evidence to, and then a few questions just asking for more clarity on the timeline around notification of assessment, information return, and then the timeline between then and the site visit. So if we could cover those off, that would be great.
Shall I start then? So the information return template is published on our website. We are just doing a little bit of a minor revision on it in terms of timescales, and it is 3 weeks after we now ask for all the information we request on that information return to be sent back to us. And whenever your site visit takes place, it will always be the same notice in terms of returning information return. We will be doing several local authorities at once and several simultaneous activities at once. So it isn't a linear timescale of we do this, then we do this, then we do this in particular time frames, because we will have different members of the team working on different aspects of the activities that we've described. What was the other question, Maria?
Whether or not there's a platform that will be used to upload the evidence being requested in the information return.
Yes, we have a portal, and Lella will be able to talk a little bit more about it.
Yeah, so at the time that we request the information return, we ask for the names of 2 people from the local authority who will be responsible for uploading the documents, and then our planners will, once we receive those back, our planners will set up the portal, which is a confidential portal for that information to be returned, and that's used for returning the return information, and also when we get to the point of asking you for case tracking information as well.
That brings me on nicely to case tracking. So there's a couple of questions about case tracking. So can we clarify, we will request case tracking information at the same time as the date of the site visit. Also, are we sharing, what information are we able to share on the 50 case tracking examples and the data protection around this information? And another question relating to this is whether or not we'll be providing more guidance around case tracking.
Okay, so I'll start, and I dare say I should be handing over to Lella for a little bit more of the detail. So we will be asking for the case tracking information when we give notification of the site visit, and we will be giving 2 weeks for that to be returned, and we are planning to update our website with more information around case tracking, including the criteria that we're using. So Lella can take you through some of the more detailed aspects of that.
So in terms of confidentiality, so all our processes have gone through the appropriate governance within CQC. So when we ask, the initial request is we ask you for 50 coded, we don't ask you for the names, we ask you for 50 coded people who fit a certain criteria. We will then choose 10 of those people. All of this is done just as a coded, and then we will send them back to the local authority and ask you to speak with those people to see if they're likely to be happy to speak with us as part of the case tracking. We do request documents at that time. They're sent to us through the portal. Our planners are the only people who have access to our portal, the portals with the local authority. They are moved into a case tracking folder which has restricted access. So we're following our processes around that. Sorry, Mary Ellen, was there another question around case tracking?
I think that's covered it. I think we've said we're going to be publishing more information on the website in the coming weeks on case tracking.
Yeah, can I just say one more thing about case tracking, Mary Ellen, is that from previous questions we've had about it, for us, the focus is about speaking with people about their journey and about their experience of the care that they've received. It's not, whilst we ask for the documents, it's not about an audit of records. It's about that helps us to support the information that people have given us. And in terms of us speaking to any professionals involved in that person's care, we would only do that in exceptional circumstances if we had some specific questions.
Great, thank you. We have got a question around the methodology that we're going to be using for selecting which local authorities we assess in which order. So around our selection principles. I don't know if this is one for you, Mary.
Yes, I'm happy to answer that. Well, just share with everyone the challenge logistically of completing 153 assessments within 24 months. So there are, it is quite, our ability to flex is limited by that. We are taking account of other regulatory activity by other regulators that is planned, and we are particularly concerned to make sure we're aware of activity for those local authorities where there is a single director across children and adults. We are wanting to avoid the situation where more than one regulator is asking for information at the same time, and also to absolutely ensure that we are never on site at the same time as another regulator. Now, I'm not saying that the assessments would never cross over, because we're talking about 153 assessments in 24 months. So, but those key areas, we don't want to see undue pressure on either the data teams or indeed the leadership teams. So that's what we're doing there. We also have to take account of local elections in terms of that particularly has an impact on the publication of reports. The Cabinet Office updates guidance every year for that. So we recognising the political nature of the environment we're in, there will be far more restrictions on this than on our provider regulation. So that as well. So we're taking out chunks of time as we go. The criteria was very important for the pilots because we wanted to make sure we got a mix of urban and rural, unitary, county, and so on. The other thing is to take account of when our teams are coming on stream. We've got new people arriving every month. We're about to embark on our third round of recruitment. So our numbers will be on a bit of a steep bell curve. So we also are going to take account of any national events that might impact. So Glastonbury Festival, we won't be doing Somerset during the Glastonbury Festival. There may be other places, Isle of Wight perhaps, where the local authority will be under other pressures that we don't want to add to. But aside from that, and the final thing we want to take account of is the integrated care system work, and who will be following us, and so trying to think about that as well. So those are because everybody needs to be done. It's not quite the same as the selection for the pilots. I hope that answers the question.
Thanks, Mary. There are two separate questions about Safeguarding Adults Board, so if we could go to those next. So the first one is around whether we would expect to talk to the local Safeguarding Adults Board as part of our assessment. And then the second question is asking for more detail around the line of inquiry or requirements from Safeguarding Adult Boards that we might be looking for as part of the assessment.
Lela, Amanda, do you want to take that one?
I can take the first easy one, which is that we are likely to talk to the chair of the Safeguarding Adults Board as part of our on-site activity. And what we're speaking to them, I'll start the second bit and Amanda can join in if you like. But what we'll be speaking to them about is about how the board works, how it works with other members of the local authority, about some of the work that's taken place, about what has been identified as risk, what areas for that they're currently working on. Amanda, do you want to add anything to that?
I think you've covered it well. I think the important thing for us to say is we're not assessing the Safeguarding Adults Board itself. We are assessing the local authorities' Care Act functions. So we're speaking to Safeguarding Adult Board chairs as a key partner in that. I don't think I have anything else to add to that, but hopefully that answers the question.
Thank you. We've got a question around how we might be accommodating additional support needs. So for those requiring additional communication support, such as an interpreter or signer, how will this work? Will we be letting local authorities know in advance who we wish to speak to, and how will that support be organised, and how much time will be given in advance?
Is Mary Ellen, do you know if that's for talking to staff or talking to people that in terms of case tracking?
I don't think it says specifically.
Okay. So what I can say in terms of, well, for everybody actually, we would expect that if someone you know would advise us if there were issues such as that. So in the pilots we spoke to a staff group where we had a interpreter was present as part of that, using British Sign Language as part of that. So we would expect to accommodate people's additional communication needs, and we would have a conversation with the local authority in terms of if it was someone we were case tracking, about whether that's best for us to provide an interpreter if that was the case, or whether the local authority would provide that. So we would have conversations about that, but of course we would want to accommodate wherever possible where people has additional communication needs.
Thanks, Lela. Can we talk a bit about how long it's going to take us to publish the reports following an assessment? We've got a question about that process. So I don't know if that's one for you, Amanda or Lela, to cover off.
So I think initially, whilst, as Mary has said, we have a calibration panel. So what we do for the calibration panel is we're grouping some reports to go through that calibration panel before they are published. So it does mean that for some local authorities, their assessment report will be published slightly longer than we would normally plan for. So we would estimate that it would possibly be around approximately 8 weeks after the site visit. But that will be variable depending on the calibration panel, and also depends on any election periods as well that we need to take account of.
Thanks, Amanda. Will we be factoring in the size and available resource of local authorities to prepare for assessment? So the person asking the question has asked, as an example, I think that's a city council versus a small unitary authority. Will we be taking that into account as part of the assessments?
Shall I have a go at that? So, well, it's the same process where there are Care Act responsibilities. So, but obviously some places are smaller or larger than others, and that would be reflected in the size of our team, but it isn't reflected in the legal responsibilities. So we'll be looking at the full range of those responsibilities, but there's no difference in terms of other than potentially the size of the team, in terms of what we'd look at.
Or shall I just add, or in terms of timescales for requests for information?
Yeah.
Thanks both. Another one's related to schedule and the process around that. So if a local authority has been notified of assessment, does that mean that the ICS that their ICS is likely to be in the next round of announcements?
That's a no. The ICS work is a little bit, is still to be finalised, and there's only 42. So there's no way that we would be able to ensure that every LA within an ICS is done before, but before the ICS assessment comes along. But things like, is it 2 years for ICS? When all that is finalised, we'll be in a better position to know. But we do, because we're looking at relationships and leadership, we do want to look at some ICS groupings together. So that is one of the factors. But you can't say, oh, we've been done, so you're next, I'm afraid.
Mary, while we're talking about scheduling, there is a question asking for clarification around information that we have previously shared, which states that information is requested within 21 days of the letter arriving, which I'm assuming means the notification letter, then a site visit anytime in the next 6 months. So could we just clarify and confirm if that's correct and that is the current approach?
That is the current approach, and 6 months would be the maximum distance between the two. And the important thing is to remember is that the assessment starts long before the site visit, and there will be different teams of people working on different elements of the assessments as we go through. And we're aiming to get as much done before we get on site as possible in terms of engaging with providers, partners, and community and voluntary groups and so on. So there'll be instances, a lot of that will be sort of in the cupboard before we're on site. And it's also there's also when I was talking about the criteria for scheduling, we also need to take account of other regulatory activity. But when you've got 153 things to do in 2 years, we have to keep going with gathering in the information in and working on what we can. So when we know we're not able to publish reports during pre-election time, we want to be maximising other activity during that time. So 6 months would be the extreme of it, and it would always be 6 to 8 weeks notice of it. Thanks, Mary Ellen.
No problem. A question that's got quite a few likes is around whether or not we will require access to council's client information systems, and then as a follow-on from that, would this also include hospital systems if discharge is recorded there?
I can answer that question because it's very easy. No, we won't. Thank you. We don't need access to anybody's systems.
A question around how staff can prepare for their interviews. So is there anything that staff can do to prepare for their interviews for when we do the on-site interview element of the assessments? For example, is it feedback on management, what they understand processes to be, etc.? Is there anything we can advise on around that?
Are you going, Mary?
Yeah, I'll have a go. You do join in, Lel, if you'd like to. So I think the first big message is don't panic. I'd like to say be relaxed, but you know, I do live in the real world and know that it's, you know, it is a big deal. But really, we're not. Just remember the big preparation is to think about the role and what's my role here. What part do I play in the delivery of services, awareness of the Care Act, and where I fit in and what I do, and to think about what I'm really proud of, what do I think we're doing really well, what do I think are our challenges. That's the sort of thought process to go through in preparation. There's no wrong answers to anything. And we're not looking to catch anybody out. We don't name people in our reports. So it's a case of, you know, but remembering the good stuff, I would say, really important. We want to hear about innovation, best practice, what's really making a difference. Lela, would you like to add to that?
Only to say that I agree with everything you said, Mary, but also we try to have it as a conversation, and also we may not ask. So if we speak to one frontline, a group of frontline social workers in one local authority, we may focus some of the specific questions differently in another local authority, because as Mary and Amanda have been talking about, we do a lot of our assessment work, gathering of evidence before we come on site. So there may be specific questions that we have for people, as well as those general principles that Mary's talked about.
Thank you both. Will we be setting a window or a time frame for when we're going to be notifying local authorities of information requests and on-site activity? For example, where LAs will know if they've not heard by a certain time that they don't have to provide information in that time frame. So it's around when we're going to be notifying local authorities, and if there's a sort of a sequence to that, I guess.
Amanda might want to come in on this, but I'm going to say the sequence is known to us, and it will be when the letter arrives with the information request, and then the further letter that arrives with the 6 to 8 weeks notice of the site visit. There's not a particular day of the month or week of the month when these letters will go out. So there's not, it's not like some other regulators where if you haven't heard by a certain day, you know you're okay for that month. That's not what we're doing, and that's really because of the logistics of the ask, as it were. Anything to add, Amanda, or have I covered that?
No, I think you've covered it, and I think our aim is we need to keep it flexible based on a number of factors that Mary's described, including our recruitment and election periods.
Thank you both. I'm just looking in the chat to see if there's anything else. There's a question around, so going back to the question around looking at systems, databases, how will we be looking at assessments and care and support plans? How will we be looking at that information?
Do you want me to answer that? So the only time we would want to look at anybody's care and support plans is part of case tracking, and we ask for that information to be uploaded through the portal.
A couple more questions around case tracking, which I think we have covered. There's a question around, I saw a question around whether we're going to be waiting. Let me try and find it. Are any of the quality statements or the evidence categories weighted more or less heavily when it comes to scoring?
No, there's no weighting on any evidence categories nor a quality statements.
We've got 3 minutes left. So don't know if you want to say anything else, Mary, or before we close off.
Yeah, well, just to say, if your question hasn't been answered, we'll be going through and looking at what we haven't answered, and we'll cover that off. We do have a final slide with some helpful links on about how to stay up to date, and I'd encourage you to sign up for the bulletins, and there's a link there for email and CQC Connect for podcast episodes and so on. The bulletins I would particularly recommend, because those will flag the new stuff that goes on the website, and we'll keep communicating and make sure local authorities are updated as we get to significant milestones. So I think just leaves me to thank you all for attending. I think we were up to 450 at our highest attendance, so that's incredible that you've all taken the time out of your day to join us, and we're very grateful. And I hope this has been helpful, and look forward to meeting many of you in the weeks and months ahead. Thanks very much.